Welcome to Adapting Class. If Pitocin math is stressing you out, you are in the right place. In this video, I will show you exactly how to break down Pitocin dose calculations the NCLEX or nursing school love to test you on. Come on, no memorization, just a clear step by step, and an easy way to find the answer and solve it without any problem. Let's get you scoring points and saving time on this easy question, but sometimes difficult. It stresses you out. When you see it, you look defeated. Let's get to it. 2 questions for you, and you will use that strategy to answer every question on Pitocin dose calculation. What is the strategy? You have to be careful because they can trap you multiple times in this question. Read the answer choice. This last portion of the question. What is the infusion rate in ml? That is the answer choice, basically. If you know it, you have your answer. So infusion rate in ml per hour. So this is what you want to get to. Your final answer has to be ml per hour. Now, let's see what the question is about. The provider orders Pitocin to be infused at what? 6 milliunits. The available IV solution is Pitocin 30 units in 500 ml of LR. This is what throws people up. But don't worry. Take your time. And the first thing you write is available. Write available down. What is available? What concentration of Pitocin do you have? The question will give you away. This is the question. He said, the available IV solution. They've given it to you free of charge. The available IV solution is what? Pitocin 30 units in 500 ml. So you tell yourself, I have 30 units in what? 500 ml. That's all. Then ask yourself, what is the provider asking you to do? Is the prescribed dose. The prescribed dose is what? He said, infuse it at what? 6 what? Milliunits. So what is the problem? It's easy. Don't worry. Let me show you. The answer choice has to be what? ml per hour. The first thing you do, make sure the available dose and the prescribed dose are in the same concentration-wise, right? At 30 units and 60 milliunits, you cannot add them together. Convert the available, which is very, very concentrated, into a milliunit. Most of the time, the infusion we give to patients is milliunits. So 30 units, you just do it separate, right? 30 units. So 1 unit is 1,000 milliunits. Therefore, 30 units will be 30,000. 30,000 milliunits, MU. Now you're done. The next thing is look at the answer choice they want you to have. They want ml to be on top and time to be at the lower portion. Therefore, in these available concentration, you see the 500 should be on top. That is the key so that you keep the ml. So I have 500 ml of the concentration of Pitocin, which is 30 units in 500. Flip it. It becomes 500 ml in 30 units. But you convert the 30 unit into what? 30,000 milliunits. So you have 30,000 MU. That's all. Now bring your prescribed dose. Your prescribed dose is what? 6 milliunits over minute. You see? Then you look at it. The time is in the right place. The ml volume is right place on top. The milliunits will cancel each other. But you note down, the time is in an hour. So convert it into an hour. So we have what? 60 minutes is equal to 1 hour. And that's all. Now let's cancel. Minute, cancel minute. Milliunit, cancel milliunit. You have ml and hour staying. Now you have 500 times 6 times 60 over what? 30,000. Cancel the numbers. I have 0, 0. This cancel this. I have 1, 0 here, cancel this. So you have 5 times 6 times 6 over 30. This is going to give you what? 66 ml per hour. This is the infusion rate of Pitocin. So a concentration of 30 units in ml that the pharmacy is going to give it to you. All you need to do is set the pump so that the patient is getting just a 6 ml every hour of the 30 unit 30 unit of Pitocin in a small bag of 500 ml of lactate ringer. This is the way you calculate it. And you can see that number 2 is the right answer. Don't freak out. Take your time. Use the dimensional analysis, but you have to know which way to go. You have to look at the answer choice they've given you. That is what they want you to have. Then look at the last portion of the question and start converting things. This is Pitocin 101, right? Same question, different strategy, but the same idea, right? What is the infusion rate in what? ml per hour. Then ask yourself, my answer has to be ml per hour. All of the answers are ml per hour. A provider orders, right? That is the prescription. You prescribe those to be infused at what? 12 milliunits per minute, right? And then the IV bag contains, you see here, they did not tell you prescribe, but they did not tell you they're available, but that's what they mean. The IV bag, the pharmacy is going to give it to you, contains 20 units of Pitocin in 1000 ml. So the available concentration is what? 20 units in what? 1000 ml of the solution. The prescribed, that the doctor prescribed, he said, give the patient what? 12 milliunits every minute. Same thing. Look at your, first convert the 20 units into what? Milliunit. So 20 unit is the same as 20,000. 20,000 MU. I like the MU instead of writing all the milliunits, right? And now I have to make sure whatever I've been giving, the available and the prescribed, I got to keep one with the volume. ML is on top and hour time below. Who as the ML is the available, which is what? 1000. So 1000 has to be on top. And then the units, the milliunit will be low, 20,000 MU, then multiply by the prescribed, the MU is 12 MU, and then minute. But we want time in what? Hour. So 60 minutes in an hour, right? And then you're done. Keep on canceling. I have minute, cancel minute, milliunit, cancel milliunit, ml stay, hour is below. Now I have 1000, 1, 2, 3 is cancel, 1, 2, 3. Therefore, you have 12 times 60, even this will cancel that, right? This will cancel that. Now you have 12 times 6 over 2. This will give you what? 36. 36 ml per hour. So this, as you can see, this is not that difficult in terms of how you look at it. If you think it's hard, then just slow down, pause yourself, figure out what you've been given, and then find out what you need to do, arrange it in such a way that your answer choice will come to you. So thank you for watching. As you can see, this is a strategy. Be careful. First thing you need to do, make sure the concentration is in unit and convert it into milliunit. If they give you the concentration in milliunit, you don't have to do anything. I'm talking about the initial concentration. If they give you to you is in milliunit, the available dose. If it's 20 milliunit, I don't have to do that. I just multiply the 20, 20, I put the 20 instead of the 20,000. So this is the way you do these things. Thank you for watching. Good luck in your nursing school and your NCLEX. All the best of luck. And if you like it, subscribe to Adapt NCLEX for more content like that. Good luck. Bye.